This video provides the revised protocol for the study Detection and Management of Non-Compressible Hemorrhage by Vena Cava Ultrasonography. The study is funded by the National Trauma Institute and is primarily sponsored from the University of California, San Diego Division of Trauma, Critical Care, and Burns. The study hypothesis is that ultrasonic assessment of the vena cava diameter and collapsibility can detect and aid management of non-compressible hemorrhage in major trauma victims. Inclusion criteria include major trauma victims at level 1 trauma centers with significant IVC collapsibility greater than 75% or an IVC less than 7 millimeters on initial fast. Exclusion criteria include pregnancy after 20 weeks of gestation, patients less than 18 years of age, prisoners and others prohibited from participating in a clinical trial, and patients with severe traumatic brain injury who at admission are deemed by treating surgeons as having non-survivable brain injury. Study procedures. All major trauma victims with an ISS that could be greater or equal to 15 undergo FAST and have their IVC diameter measured. If significant IVC collapsibility greater than or equal to 75%, or IVC diameters less than 7 meters are seen on the initial fast, the patient is a study candidate. The patient receives standard of care resuscitation, and a CT scan of the abdomen or a repeat fast exam is obtained after 40 minutes. Patients who have continued collapsibility of greater than or equal than 75% or an IVC diameter less than 7 millimeters at the second study are non-responders. Those patients having decreased collapsibility less than 75% or an IVC greater than 7 millimeters diameter are responders. Enrollment procedures and consent can be obtained after the second study. A follow-up fast after consent, 8 to 24 hours after admission, should be performed when the patient is considered resuscitated, but not later than 24 hours after admission. Here's an overview of the study design. A major trauma victim is admitted and undergoes initial fast exam. If the patient has 75% or more greater IVC collapsibility or has an IVC less than 7 millimeters in diameter, they could be a study candidate. They undergo standard of care resuscitation, and the second imaging shows whether the patient has continued IVC collapsibility or small vena cava. If they do, they are a non-responder. If they don't, they are a responder. Both groups can be enrolled, and the third imaging, which is a fast at 8 to 24 hours, is obtained. The total enrollment planned is 600 patients at up to 4 centers, or about 125 enrollees per center. During the study period, it is required that a modified fast is performed to obtain the IVC views. The data will be entered at the AAST MITC dedicated website, and images, data, and video will be uploaded to the website. Quarterly reports may be required. For the ultrasound procedure, the IVC diameter is recorded for 2 respiratory cycles. Record in the transverse plane and then in the sagittal plane. The probe can be placed either on the epigastrium or under the right flank. IVC diameter should be measured 2 centimeters below the IVC hepatic vein confluence. The IVC assessment is performed as part of the abdominal fast exam. Records submitted must have the patient's ID embedded within the study. The probe is placed in the epigastrium and a longitudinal view is taken to identify the vena cava. Identifying a location about 2 centimeters below the hepatic veins is where the transverse view should be taken. Here's a view of a collapsible IVC, and the desired location is about 2 centimeters below the hepatic veins indicated here. Rotating the probe in that plane will produce a transverse view of the vena cava just below the hepatic veins, as shown here. In some patients, body habitus, intra-abdominal gas, or obesity does not allow a good view of the vena cava through the epigastrium. In those patients, looking in the right upper quadrant between the ribs using a small phased array probe can allow a view of the vena cava. First, look longitudinally to identify the cava and the hepatic veins. Once the vena cava and hepatic veins have been identified in the longitudinal plane, the probe can be rotated 90 degrees to allow a transverse view of the vena cava about 2 centimeters below the hepatic veins. Vena cava images should be saved as motion picture files, either as AVI or MPG format. Depending on your ultrasound machine, these can be later exported using a USB drive, and the study images can be maintained that way. Another option is an external optical DVD drive, which could be used to retain the images for the study. If you have any questions regarding the protocol, please contact the study PI or the study coordinator at the addresses shown. Thank you for your attention.